Danielle said, oh, thank you. As Danielle said, this is a slightly different RareNet Forum today. I'm just going to share my screen. Apologies that you can't see me. For some really strange reason, my camera doesn't work with Zoom. So it works with everything else, but not Zoom. So unfortunately, you don't get to see me today. But can everybody see my screen? Yes. Okay, beautiful. Okay, so today we have two different presentations we're going to share. It's a little bit more, I guess, of a webinar style format of RareNet today, as opposed to our typical discussion. The first presentation is Lauren Roberts, and she's the Head of Development of Rareminds UK. And for those who aren't familiar with Rareminds UK, it's a really incredible organisation. It's based in the UK, but their reach does extend internationally, and it was really set up in recognition that mental health care is so critical in the rare space, but also that the way in which rare care is designed and delivered needs to reflect the unique diversity of our rare communities. And so they carefully accredit, design, and deliver rare-informed healthcare, mental health care to other patient support organisations and community. And she's going to share a little bit, this is a recorded presentation, she's going to share a little bit about the Rareminds UK survey. And then the second presentation is Matt Bolz-Johnson, who some of you may know. He's the Mental Health and Wellbeing Lead and Healthcare Advisor at EURODIS. And he, both of these amazing human beings have recorded these presentations specifically for us today, but they are long. So Matt's in particular is worth watching from the very start, but we're going to start it a little bit further in, which is specifically looking at the mental health, co-designed mental health toolkit that EURODIS is building that'll be launched in March next year, because that really will form the basis of our community reflections and discussion. So a huge thank you to both Danielle and Monica. Monica's not joining us today because she's in Barcelona, for putting together the whole October wellness program and the amazing sessions that you've run so far, and also for putting together these resources for our session today. I just want to really briefly touch on this because we have new members or new people joining today that haven't been to a RareNet session. So today's RareNet session is slightly different. We don't normally have long presentations, and it's primarily discussion. And the objective is really just to provide a community platform where people can come together on a regular basis in whatever capacity they can. So you don't have to join every month, but it's that regular touch point to explore some of those disease agnostic priorities and to collaborate across the rare and genetically undiagnosed network. And the goal is to try and generate one idea per RareNet session that we can build on and support the delivery of. Okay, so I'm going to pass to Danielle to run the first video. Danielle, you may need to just automatically stop me sharing my screen, apologies, and then share yours.
Yes, it's funny, we still have to go through these steps to okay, so Rareminds. All right, I'm going to assume everyone can see my screen with Raremind Matters. And I'm going to press play. Thank you.
Great. Thank you.
Hi, everybody. My name is Lauren Roberts, and I'm the Head of Development at Rareminds. Rareminds is a UK-based charity that provides mental health support for people with rare conditions. I'm here today to talk to you about the results of our Rareminds Matter survey. So this is a survey that we launched for Rare Disease Day in 2023, and we then published the results, in a report earlier this year. So just before I get into talking about the survey, just a little bit about Rareminds in case you don't know of us. As I mentioned, we're a UK-based charity who was set up in 2020 by Kim Winter, Kim has personal experience of a rare condition in her family, but has also over 30 years experience as a psychotherapist, and for a long time wondered, where is the mental health support for people with rare conditions? And so in the end, like many in the rare community, she realised she was just going to have to set it up herself. So we were established initially as a community interest company. We then got our full charity status about a year ago. And our vision is that the psychological and emotional aspects of living with a rare condition are recognised as a really integral part of rare disease care, and that everybody has access to quality services. So it shouldn't be that mental health support is an add-on or, something you get if you're lucky. It's just as important as looking after the physical impact of a rare condition. So we have 3 aims. Our primary aim is to actually provide access to affordable specialist psychotherapy, counselling and wellbeing support. So since 2020, we've provided over 4,000 counselling sessions, either to individuals or couples. And all of the work that we do at present is in partnership with other rare disease organisations. So we partner with them, and that allows our counsellors to develop expertise in that particular condition. And we think that's really important. So all of our counsellors have undertaken training in our CPD module on mental health and rare conditions, but they also develop expertise in the particular condition of the community they're working with. And that's because no one should have to be the expert patient when they're trying to access therapy. We also want to become a centralised hub of expertise for rare disease mental health information to help inform policy and practice and promote really good standards of excellence. And at the moment, we are also campaigning for increased recognition of the importance of specialist mental health support. So just declare my conflict of interest here. Obviously, there's a little bit of a conflict between our first and our third aim. We know that we are a specialist provider and we're currently campaigning for people to have access to specialist provision. Our board has taken the decision that at this point, there's nobody else that holds the same kind of expertise and knowledge that we do. So that we feel we have a responsibility and a duty to share that information, advocate for the mental health needs of the rare community. But hopefully in an ideal world, we'll be able to stop doing number 3 and we'll just be able to focus on our main aim, which is around being really good providers of specialist care. So just before I go on to our survey, I just thought I'd set the scene a little bit. In 2018, there was a report published in the UK by Rare Disease UK, which explored rare diseases and mental health, and in particular the impact that having a rare condition had on mental health. And this was very much the kind of first survey of its kind. This isn't something that had really been looked at properly before. And then there was a follow-up paper from that initial report in 2022. And you can see here that it presented a pretty bleak picture. 95% of respondents felt worried or anxious, 90% had felt low, 70% had felt breaking point, and 39% of patients had suicidal thoughts. And one of the key things that came out of this report was that the challenges of having a rare condition wasn't just about the condition itself, but it was the experience of healthcare, and particularly about not being taken seriously by healthcare professionals or the kind of diagnostic odyssey and the way that that could add to the stress and trauma. Only 23% of respondents to this survey, this report, felt that healthcare professionals considered their mental and physical health as equally important. So as I said, this presented a pretty bleak picture, and not much really changed after this. I think anecdotally, most people in the rare community recognised that this is a situation, but it wasn't really given a huge amount of attention. And then obviously the pandemic happened, and we all know that that had a really significant impact on mental health of everybody generally, but particularly the people in the rare community. And it does feel like finally things are starting to shift a bit, and that mental health has been seen as the kind of missing puzzle piece in the rare disease journey. So this year in particular feels like a bit of a turning point for rare diseases and mental health. So in April of this year, we published our survey, which I'll talk you through in a moment. But also that month, the Specialised Healthcare Alliance in the UK published a survey of their members. So they're an alliance of 140 charities and corporate partners. They surveyed them about mental health, and you can see here that 84% of their respondents described the availability of mental health support for family, parents and carers of people living with a rare or complex condition as quite poor. They had a number of recommendations. And these included the need for mental health support to be accessed in a timely and equitable way. And also they thought it was really important that mental health support was open to families and carers, that it should be delivered in partnership with charities, and that it should be offered through peer support networks. In June, sorry, I've jumped ahead. In May of this year, we also launched our Wellbeing Hub, and I'll share links to that at the end. But this is a free resource for anyone in the Rare community to use to help talk about some of the mental health challenges they might be facing and help them think about ways that they might manage that. And then in June of this year, EURODIS, the Rare Disease Europe organisation, launched their mental health initiative and also their outline paper on mental health and wellbeing. And this is a really important step towards mental health and rare conditions being kind of recognised on both the European but also the international stage. And if you haven't yet had a look at this paper, I really encourage you to go and do so. It very clearly sets out a number of recommendations at the kind of national, service and individual level of how we can look to better serve mental health needs of the rare community. And I've just pulled out one of the recommendations here because it's one that particularly resonates with us here at Rareminds. And that's about how if integrated psychosocial support could become an integral standard of medical care, then actually this would really just help overall with promoting mental health and wellbeing. So at Rareminds, we're always really clear that it's not that everybody will need access to specialist mental health support, although some will. And it's not that we want a kind of new, completely distinct service set up. Actually, we could go a really long way just through having psychologically informed care embedded throughout the care pathways in the rare community. And that would help to alleviate some of the kind of accumulated trauma that happens to people through their experiences of healthcare that then often results in them needing specialist healthcare at the other end. So here's a kind of snapshot overview of our survey. As I mentioned earlier, it was released in February 2023, and then we published the results earlier this year. And you can see here that it's still a pretty bleak picture. We really wanted this survey to kind of be a bit of a snapshot. So it's not the most academically rigorous survey, but we're pretty, we tried quite hard to make it as representative as we possibly could. There was 695 respondents and there was 188 conditions represented. It does have some limitations though, so I'll just let you know quickly what they are. Like many surveys, it was overwhelmingly white British or white people who responded. So it doesn't really reflect, or potentially doesn't reflect, the experiences of minority ethnic communities, especially ways in which their experience of a rare condition may intersect with other experiences such as poorer healthcare or racism. Also, it was predominantly people, it was individuals who responded with a rare condition as opposed to parent carers. So the results are probably more reflective of life with a rare condition rather than caring for someone with a rare condition. And also that many of the conditions were ones that have quite a big physical impact. So if you just bear that in mind with a lot of the results that you're seeing, these probably are more reflective of individuals who have a rare condition that very much impacts their physical nature of things than potentially something that's less of an impact in that area. And also, so there were two parts to our survey, and one was for individuals and one was for rare patient leaders who run groups or charities. And of the second part, there were more representatives of people who are running small groups. So over 50% of the responses were from people who run a very small rare disease organisation where they have 5 or less volunteers or staff, and they have a population size of less than 50 people. So having said all of that, here's the kind of the headline results. We found that having or caring for someone with a rare condition can have a negative impact on mental health or wellbeing. So 85% of people reported a negative impact. 41% told us that it had a negative impact on their family relationships, although 16% of people reported a positive impact, which was also really nice to hear. And many people talked about how they felt that it strengthened their relationship. As I mentioned earlier, we found that experiences of healthcare could have a really significant impact on mental health, either as a protective factor if you had a really good relationship with your healthcare provider or professional, or a very negative one. And we found that 41% of people had tried to seek mental health support independently, but the story they sort of told us was this is very complicated. And 75% had never been offered or signposted to mental health support. As I said, we also wanted to explore what was the impact of on the mental well-being of rare patient leaders, because we know there's often a lot of overlap between people who are running groups or charities who also have personal experience, either through having the condition themselves or as a carer. So we wanted to know what was life like for them. And as you can see, 62% told us they were concerned about responding to people in crisis, and 61% were worried about sort of maintaining those boundaries and knowing it's okay to step back sometimes. So based on this, we came up with five key findings and 6 recommendations. The first one, the key finding feels very obvious, but we felt that maybe we needed to state it just in case. And that's that living with a rare condition creates additional particular challenges for mental health and well-being. And some of the challenges that people identified were things like worrying about the future, fatigue, lack of healthcare professional awareness, managing uncertainty, and dealing with anxiety. And it became really clear that it's a really big psychological task coming to terms with what having a rare condition means for your life. And that we think that really what people need, as I talked about earlier, is this idea of psychologically informed care, where everybody involved in the rare pathway for that person at least is thinking about what it might mean for their mental health. So that could be as simple as thinking about, if you're delivering a diagnosis, doing it in a way that's sensitive and in a place that's appropriate, so it doesn't create more trauma that has to then be unpicked further down the line. So our recommendation for this is that a holistic, integrated approach to the care of people impacted by rare conditions that includes consideration of mental and emotional well-being is essential. We also found that rare conditions affect the usually protective function played by family and couple relationships, and that this obviously has a really big impact on mental health and well-being. And this can particularly be the case in families where there might be an inherited genetic condition, in a way that can create additional stresses and challenges and complications. So we think it's really important that individuals, couples, and families are supported to manage the dynamic of rare conditions on personal relationships. We at Rareminds are really big proponents of the idea of not just individuals counselling, but couples counselling. And we found that often if you can really support the couple to be able to rebuild and re-understand what their relationship looks like in light of the rare condition, then this is a really strong basis for everybody else in the family to be able to cope in a positive way. So I mentioned this a lot already. Relationships and interactions with healthcare professionals have a really significant impact. And one of the things that I think was one of the most significant statistics to come out of the survey was that 75% of people had never been signposted for any kind of mental health support or offered it. But when we had a follow-up question of the 25% who had been offered or signposted and said, did you take it up? 87% of people said they'd taken it up. So that shows there's a really clear demand for this. It's just that people aren't being offered. And so our recommendation is that anyone impacted by a rare condition should receive psychologically informed, rare aware care from the healthcare professionals they encounter. So that psychologically informed care might be direct, it might be having access to specialist mental health support, but it might just be indirect, as I said earlier, about people taking the time to say, how are you doing today? How are you feeling about this? Or making sure that the interactions are taking place in a sensitive way, in an appropriate place, so that they're not creating more stress and trauma for people. So we found that mental health support is desirable, but it's not always easy to access services. 96% of people told us they thought it was really important if they saw a mental health care professional that mental health healthcare professional understood rare conditions. And we heard quite a lot of stories from people in the survey about how they tried to access mental health, maybe through their GP or through other mainstream ways, but that actually it was really difficult, either because the mental health professional didn't really understand their condition, so the advice they were given wasn't appropriate. Sometimes it became a barrier because the counsellor or psychotherapist didn't feel equipped to be able to support them. And sometimes also people were just told that actually maybe it was a result of their condition. So there's many complicated ways in which having a rare condition can act as a barrier to mental health support. And that's why we think it's so important that there's not only sort of access to specialist care, but general upskilling of the whole kind of workforce to understand more about the impact of rare conditions on mental health and well-being. Finally, we found in part 2 of our survey that the level of mental health support provided by rare condition groups and leaders can impact on their own mental health and well-being. And this was something we've long suspected and known through the work that we do, but we really wanted to explore more. And we think it's really important that lived experience and third sector support for mental health and well-being shouldn't be seen as a replacement for statutory provision. We all talk about in the rare community how important peer support is. And we know that the peer support groups and charities play an absolutely essential and invaluable role. There's nothing quite like the support, just being able to meet up with other people that just get it. We have to make sure that the people that are running these groups and are volunteering for them are supported with their own mental health and well-being. They can't just be the ones that are kind of soaking up for everybody, being there for everybody else, but not being supported themselves. We need them to be able to keep going because our whole sector rests on them. So there really needs to be ongoing support training for rare leaders and peer supporters so that we can safeguard their mental well-being and ensure that they are able to carry on playing the absolutely vital role that they play. So that was a bit of a whistle-stop tour. There's lots more that I could talk about, and if you're interested or you have any specific questions, please do feel free to drop me a line. So that's my email, and then there's also a couple of links there. So the top one is to our Wellbeing Hub, which I mentioned earlier, launched in May of this year, and that explores the different challenges of having a rare condition, so things like relationships, navigating healthcare, managing uncertainty, dealing with diagnosis. And it's been co-designed between people with lived experience of rare conditions and our clinical team. The survey report is also there, so you can go read that if that's useful or if you're interested. And then finally, just to say, we launched a podcast earlier this year, which you can find if you search for Rareminds on Spotify. It's about 6 episodes out. Currently, they come out monthly, just exploring all of the different ways that mental health can be impacted when you have a rare condition. Thank you very much for your time. As I mentioned, if you do have any questions or any queries, please feel free to get in touch. Thanks a lot. Bye.
Beautiful. Thank you so much for showing that, Danielle. And while you queue up the next presentation from Matt, I just wanted to ask if people are across the survey, or have you used it in any advocacy? Have you had any discussions about it within your own organizations?
I think we have had some discussions around the use of, I guess, the importance of mental health. I think I've written a blog about it actually on our website, but I think that this survey has been mentioned also by, I think, Rare Voices at some point.
Yeah.
I think they referenced it at one point. Yeah, so I think it kind of is in discussion, but I don't think it's made very clear to the actual community. Maybe to us who do a bit more of the admin side of foundations or organizations, but maybe not as much the actual community.
Yeah, thanks, Ali. I think you're absolutely right, and obviously, rare mental health is such a focus for RBA as well, which is brilliant. And this survey, Rareminds UK are very happy to make this the survey questions available to us in Australia if we wanted to run something like this to get Australian data. I am conscious that there's a lot of research going on now across the sector around the psychosocial sort of impact of these diseases. So it's one we can talk about at the end, just in terms of you know, the role of being able to collate and use these really powerful data sources in our advocacy around support, not just for psychosocial care integrated into rare models of care, but also support for the organizations like all of ours who are trying to deliver and meet the needs of mental health within our community too. So we can chat about that at the end as well. But I just wanted to stress their desire to collaborate, a willingness to collaborate with us. And they are also a key partner in informing the EURODIS co-designed mental health toolkit, which is the subject of our next presentation. So did anyone else want to share anything or have a reflection before we move into the next presentation? No? Beautiful. So we're going to start this presentation at about 8 minutes in. So the first part of this is really worth watching in your own time if you can. And feel free to just use the chat function. But has anyone had much exposure to EURODIS's co-created mental health toolkit before? Okay, so Monica has been a significant part of this process, I guess, from an Australian perspective. And this has been months and months in the making. There are about 86 different organizations across the world from any country you can almost think of that have fed into this process. So it has been a truly, I guess, patient co-designed toolkit. And one of the things we want to talk about at the end of this is what does that mean for us in Australia? What are some of the ways in which we may be able to utilize this, advocate for this, understand its utility in our own advocacy work. So Danielle, I'll let you play from here, which is really just drilling down into the toolkit part of the presentation.
We had the call from our community to prioritise mental health and take action. And instead of sort of always looking and advocating what other national institutes should do or what health expert teams should do, we wanted to collect a bit, map out the good practice out there, the approaches which have worked for you in your communities, and make that more visible across the board in a toolkit. So we started at our ECRD earlier this year. We launched a co-creation process. We had a very lively participation, and Monica was there in the room. And she, as I said, she's been involved in all our co-creation process workshops since. In this event, and you can see Monica there in the center picture, we identified 4 key topics we need to look at: self-care, family support and support systems, community and peer support, a chapter on advocacy tools to help advocate for psychosocial care to be available to identify those gaps, and tools for healthcare professionals as well. We have had a busy summer. We had 4 workshops over the summer period, and we're at the stage now where we're writing up this co-creation process, which has been really energizing. We're writing up into a blueprint for the toolkit, how we're going to structure it, and we'll do some analysis of the tools which we've already mapped. And we aim to write this up in Q1 next year and publish it in Q2. So the toolkit is going to be called Reaching Beyond Rare Mental Healthy Toolkit. It's going to be disease agnostics with self-care tools and empowerment tools. It will aim to address a core set of psychosocial needs experienced by our community, for instance, how to disclose and communicate about rare conditions, to look at addressing mental isolation and chronic uncertainties, prevent burnout and build resilience. We want to make it very much visual, so we want and present real life situations. So we're going to do short vinaigrettes of short stories of examples which show how these tools can be used based on real world experience, and it will cover the whole life course from childhood through to growing up and adulthood. The toolkit will also look at addressing some common needs, which not all conditions are relevant to all conditions, but a group of conditions are related to. So sleep problems can be a common issue, pain management, reduced mobility, visible, invisible difference, complex behaviours, and financial and relationships stresses. Those 4 chapters which are highlighted with these are the workshop results. We identified that we need to have tools which can signpost people to access information, to find specialists, access psychological support, information on patient rights and treatment options, how to be connected into a community, providing telephone support, or more on an informal basis, maybe these private Facebook groups where there's good moderation, self-care and awareness tools which can promote coping strategies and nurture resilience, prevent burnout, communication skills and tools which help families to talk about their feelings and to talk about the condition, but also tools which can help support families navigate those personal relationships as well. Some empowerment tools on how to navigate the healthcare system, checklists which can be used to support you talking to clinicians, not just about the physical health needs, but also on the mental health care needs. For example, how to prepare for an appointment. And the second chapter will focus on the community and peer support. And this is very much looking at the first level is that more informal Facebook form. Sorry. The first one is looking at more informal group activities like Facebook groups, virtual support groups. But the second one is more looking at how you can be connected into a more formal group activities, like in a patient organisation, they do a lot of activities on sport or leisure activities, where it's not necessarily focused on the condition, it's focused on hiking, sailing, summer camps, which get people to connect with other people in a more positive way, and forgetting about the rare condition. An example being for NF1, a lot of times children come together in summer camps and play, and that give themselves challenges to overcome, so they build their social networks and build their confidence. The last one is more on section on in this chapter, looking at one-to-one support. That could be mentoring or peer support, and accessing psychological support. The third chapter was really, there comes a point where patient groups, we have to sort of stop, and we're very good as a community stepping in and filling the gaps where there should be services available. And it's really important to set a boundary and saying, well, when people need a level of professional support from statutory services, that a lot of the time these psychosocial services aren't available. And instead of stepping into that as a community and filling that gap, we want to identify what these services should look like and to give the tools to you to be able to advocate for that in your local area. So these tools are very much around what there can be like a checklist to help you talk with professionals about holistic needs. They can be examples of what good psychosocial care looks like, or holistic care, and what services should be available. Good practice models. There's in Luxembourg and in Germany, they've got some good examples of how psychosocial care can be delivered, maybe in an alternative way. So trying to paint what that could look like in different countries. Providing information packs with checklists and information. We want to also not just show what you can do, but also what you should seek. So information about rights, about health literacy, on how to promote better patient agency, what language you should use with clinicians. Sometimes that can make a difference. Giving guidelines or journeys which can be used to show what care you should be getting. And cross sector collaboration. So because a lot of rare conditions are multi-system, you need to have collaborations and partnerships between different agencies to support those needs. So we want to give some examples of how those partnerships can work to share knowledge and resources. Promote good practice like patient navigators, which we've seen in some hospitals, and also give examples of how patient groups can set out the case for change for services to include more psychosocial support. The last chapter is going to be aimed at healthcare professionals, which can be broken into patient-led training or on HCP training. The topic areas which we've identified so far is the training can be about explaining to clinicians about the condition, how it affects individuals, the challenges and unmet needs. There can be training on how to deliver a diagnosis in terms of communication. The importance of patient perspective in those, to include patient perspective in how services are developed and improved. Also, tools like platforms to share information between different stakeholders. An example being that I think Rareminds and Medics for Rare Diseases have got some really good training around rare disease training for more the medical team, for the mental health teams, and training for clinical teams on the impact of rare conditions on mental health. So we've got a set of examples which we're going to write up. So that was the outcome of the workshops which we've had so far. We're now working on the blueprint and to give a sneak preview on what that would look like. So the toolkit will provide access to existing tools and approaches which build the rare disease community's capacities. It promotes protection factors, some like I mentioned earlier, tools which can be used to develop the resources of individuals and their family members to live well and promote emotional well-being. We've got 6 chapters or topics which we'll cover. The first one will be on self-awareness, awareness of the importance of looking after your own well-being, not prioritizing always maybe the person who's been affected, but the carer. If you're investing into the carer or the parent's well-being, ultimately supports the individual as well. This topic will also have some self-care and coping strategies included. The next section will be about rare resilience, tools which can help self-efficacy to build support systems and foster relationships. There'll be a topic area around practical tools, that access to information, empowerment tools, and advocacy tools for psychosocial care. The 4th section will be on caring connections, how to find people like me, being in a community that wants one support, and also tools on becoming an advocate. The fifth one will be more that common needs section, like mood, sleep, pain management. So how to make sure that there's meaningful management of those symptoms and side effects. And the last section will be for healthcare professionals. So hopefully you can see that we've, through our co-creation process we've had, which was very lively, we've come up with some good topic areas, and now this is taking shape in how we will have the toolkit. If you have some good examples of tools which you use, what's worked for your community, please share them with us. We'd love to learn, and we can maybe put them in the toolkit as well. So share it with other communities. But hopefully that shows the importance of this work, and I'm really excited to when this is published next year, because as highlighted at the beginning, the importance of improving our quality of life as a community is absolutely essential, and hopefully this toolkit will go some way to do that. Thank you.
Okay, amazing. Thanks, Danielle. And I know it was a little bit of an unusual RareNet in that we shared these two presentations, but it's often really difficult to find the time to sort of sit down and review a lot of this content. So just carving out a space to do that can be valuable. So we just wanted to open the floor now for the last 10 minutes. Really what Monica and I and the rest of the team were interested in understanding is reflections on the toolkit, which should be launched in March next year, how it could be used here, who we should be advocating to and ensuring awareness of such a toolkit, for example, mental health organizations, etc. Yeah, so I'll just open the floor to any comments, reflections.
Emma, I'd like to say something, mostly from the lens of the lived experience of medical trauma, because I live with a rare disease. And I must say there is a challenge. I have personally experienced that challenge of finding the right mental health support that is targeted to understanding rare disease and its impact. So I really think, what we're doing here is so powerful for individuals and their families, because, yeah, I can absolutely express that it is yet again placed on the individual to find that support service that is targeted, and you are still required to share your experience over again down to what is the rare disease that you live with and how it impacts, to inform, in my case, the psychologist. So it wasn't it wasn't a innate or an organic understanding of rare disease, and that further impacts, the individual, in like, again, to the re-traumatization of expressing all the way from the beginning what the rare disease is. So I just wanted to share that with the group and see if anyone wants to add on or have that experience as well, to to please share or reach out to me, because, yeah, again, the support services need to have that clear focus on rare disease for us. Thanks.
Thanks, Danielle. I think it's not only is it a courageous share, but it's when you're sharing your own personal story, but that's definitely reflected in some of the people that come to GAA, because they may not even be in a space where they're able to go and get a mental health care plan with with a GP, and accessing psychological support through more formal or systemic channels is a challenge, especially if you don't know whether you're going to be really well understood. And a lot of the groups, or a lot of the individuals, I guess, that we're thinking about don't have the amazing support organisation wraparounds, like are offered by some of the incredible advocates on the call now. Like, for example, we've got members from MITO, from MPCD. For me, I'm really interested in exploring how we can address that in the absence of, that community-led support. And then also, how do we make that feasible? How do we make community-led support more feasible and sustainable in organizations too, given that, it's a disproportionate burden often on organizations?
Yeah, agree.
Definitely not putting anyone on the spot, but has anyone seen anything about the mental health toolkit so far? And if the answer is no, what would you like to be sent about it? Because we could get Monica to put together some more resources about it, and obviously we'll send these videos, but what would be helpful for people or anyone that's wanting to learn more?
Hi, Emma, it's Tony. Thank you very much for today. I think this has been really great to see. So just, I'll come to your question, but to just take a step back and reinforce what has also already been shared is, I think there's a lot of that is validating in what we've just seen and heard for anyone with lived experience, and certainly our community in the mitochondrial disease space. And this is a hot topic for us. It's an area that we want to make sure that our community is aware that what is available and help to fill some of the gaps. So it's really reassuring to see these broader pieces of work that are global, but absolutely have Australian relevance, and we can play a role. So to come to your question, I think we're very interested in continuing to understand what is going on and what's available, and something from Monica could be really, really great to do that. Happy to contribute in any way. Just also flagging that we're on the hunt for this kind of information so that we can connect our community to the right places as well. So thank you very much for making all the connections.
Oh, thank you so much for sharing that, Tony. And I always think when MITO is on board, it's really amazing, because you have such investment into broader community as well. We'll definitely follow up on that point then. So when Monica's back from overseas, maybe the next step is we can have a call directly with Matt Bolz-Johnson, so we can have a bit of a discussion around like his advice on how this can be used and advocated for at a local country level. So he's definitely happy to support. He actually offered to present today, but it would be like 2 a.m. for him, and so we thought let's share the first presentation and gauge interest and go from there. And just a question following on from you, Tony. Do you think it could be helpful to have some kind of way of, I think accrediting is the wrong word, but the Rareminds UK model trains psychologists and peer support counsellors and other staff providing services through their program, and that then is kind of that layer of reassurance that the services provided are that rare and trauma informed. I know we have trauma informed services here as well. Do you think there's a need for something similar to Rareminds services here in Australia, or a partnership with them to deliver it here in Australia? Or do you think that there is enough here already? We just don't currently have the best pathways and access to it.
Yeah, good question. I think it's possibly the latter, but that doesn't mean we shouldn't try the partnership approach as well. I think, in our space, we work with quite a number of volunteers in our community that then provide peer support and facilitate discussions, and we like to equip them with the skills and make sure that they're okay. And so we've accessed things like accidental counsellor, mental health first aid, and it was great to participate in last week's trauma-informed session as well. So I think there are tools out there, but whether it's wrapped together in a way that makes the most sense for our purpose, maybe it could be better.
Okay, that's really helpful feedback. And it'd be interesting to sort of, I guess, audit what is available here and how accessible it is for some of those really small organizations providing, providing the stopgap to a lot of these services. So that could be really interesting to do as well. And we only have a few more minutes, so I just want to open up and see if anyone has any questions that they want to ask anyone in the group. No problem. And you can ask questions at any point. Doesn't have to be on the call. Where to from here? We'll connect with Monica when she's back and put some suggestions back out to the RareNET group around how to progress our own understanding of the toolkit, what's been done, how it could apply. And then I think from there, also obviously in partnership with other key stakeholders like Rare Voices, understanding where how we can advocate for this toolkit through different channels. And the next RareNET Forum is on November the 27th. And the hot topic for this one is data governance. So this is coming up a lot in a lot of national and sort of non-national research projects. And there's a lot of interesting updates in this space. So that's the November 27th. And it's just 12 to 1 as well, isn't it, Danielle? Same time.
Yes, correct. Yeah.
Yeah, beautiful. And then the final meeting for the year is December 11th. And it's a coffee catch up. And so one of the things we heard when we first set up this forum is that just having an open agenda to be able to bring challenges that you're facing across the different organizations together and look at where there's that real kind of intersection of those challenges or opportunities to collaborate. Or just even have a social hello and cuppa. So that's December 11th. So for those who haven't been totally swarmed by kids on school holidays and want to join, we'd love to see you at that one too.
And of course, my plug for the final workshop in our series next Wednesday is establishing online communities, which I hope will be a valuable session looking at research and tools to build successful online community engagement and doing that safely and respectfully. So places are still available. So jump onto Eventbrite and register for that next Wednesday, the 30th of October, 12 p.m. to 1 p.m. And after this session, I will also, as part of the October Practical Wellness Month, send all the slides, copies of the recording, and the feedback form, like I said at the start, just to gauge your feedback, any ways we can continue to improve our program, make it a very valuable experience for you all. So thank you for your time.
Thanks, Danielle, and thanks everybody for joining. Look forward to seeing you all soon.
Thank you, everyone.
Thank you.
Thanks. Oh, good. Good. I thought you were going to stay on, so I'm still in the meeting.